Hi, my name's Dr. Rana Higgins. Welcome to our weekly Innovations video series here in the Department of Surgery at the Medical College of Wisconsin. Today I'm joined by Dr. Tammy Kindel, who's one of our faculty surgeons here at the Medical College of Wisconsin. Dr. Kindel grew up in Ohio. She then went to Chicago and did her general surgery residency training at Northwestern University. She then did her minimally invasive surgery fellowship at University of Nebraska, and then came here to Milwaukee at the Medical College of Wisconsin, where she's been one of our faculty bariatric surgeons for the past 2 years. So welcome, Dr. Kindel.
Thanks, Rana.
Today we're going to be talking about adolescent bariatric surgery, which is a passion of yours. Yes. So tell us, for most people, we really think about bariatric surgery in adults. So what is different about adolescent bariatric surgery, and how does someone qualify?
Right. In terms of the surgery, it is very similar to adults. So we do the same types of procedures in adolescents that we offer to adults. The most popular procedure is a sleeve gastrectomy. We can do gastric bypasses in adolescents, and then very infrequently gastric bands. Really what's different about adolescents in terms of bariatric surgery is the evaluation process and who we consider to be a good candidate for bariatric surgery as an adolescent. So for an adolescent, we at our program do not have an age cutoff. It's kind of a soft age that they need to have reached a Tanner stage of 4, which is a grading of sexual maturity. You want to see that there's most of the bone development has been complete. And then really importantly is their social maturity. In terms of BMI, the BMI criteria is very similar to adults. So we start thinking about adolescent bariatric surgery at a BMI of 35. And then they usually have a significant comorbidity if their BMI is 35 to 40. So for instance, severe obstructive sleep apnea, non-alcoholic fatty liver disease, or something known as non-alcoholic steatohepatitis, type 2 diabetes requiring medications like insulin. And then for a BMI over 40, in adults, the NIH has said that those patients meet criteria just on that BMI alone. But in adolescents, we usually like for them to have some sort of obesity-associated disease, whether that's pseudotumor cerebri, polycystic ovarian syndrome, gastroesophageal reflux disease. They usually need to have some disease associated with their obesity to meet criteria. And then beyond just the BMI criteria, the program and how the patient's evaluated is a little bit different. So we really try here at Froedtert to utilize the experts within the field that can best serve the adolescent. So we have our adolescent bariatric program housed within Froedtert in the Medical College. And then we use an obesity specialist at the Children's Hospital of Wisconsin, who's housed within the gastroenterology division, to help us with obesity management and some of the diseases related to obesity. We have a dedicated adolescent behavioral health specialist, which is a very important part of the program, to help make a unique assessment of the adolescent for bariatric surgery, which is different for an adult. And then we use our bariatric nutritionist here at Froedtert. So it's kind of a combination of the two programs to really best serve the adolescent.
So it sounds like it's very similar to the steps that adults need to go through. It's just tailored more so to adolescents.
To the adolescent and some of their unique needs. I mean, I think
what are some of those unique needs in the
I think that the behavioral health component is especially important, right? So an adolescent who's considering bariatric surgery doesn't do that in isolation. They have their family to consider, school, what are their plans when they get out of perhaps high school? Are they going to be living by themselves? Are they going off to college? Are they dealing with the emotional impact of their obesity, like bullying? And so having a behavioral health specialist to really help feel out those problems is really important, I think, to their long-term success.
And speaking of long-term success, what is the long-term success in an adolescent who undergoes bariatric surgery?
It's exceptional. So it certainly meets the adult literature in terms of the amount of weight loss that patients can lose. It appears that they lose it for the long term as well, and potentially even better improvement in their obesity-associated disease improvement compared to adults. So they really have a very vigorous response. And There's a lot of reasons to think about adolescent bariatric surgery versus adults. If you wait, the adolescent just develops more medical problems, and so they are a sicker adult if you wait, say, until they're 25 to do bariatric surgery than doing it when they're 15 or 16 and maybe a newly diagnosed type 2 diabetic. And so they have a better chance of that type 2 diabetes going away and a really great long-term success rate.
So really trying to address and get a hold of the obesity-related medical issues before they develop even further.
Even further, and potentially are not treatable or correctable at that point.
So if somebody's interested in their adolescent having bariatric surgery, what do they do? What are their options? Who's the first person that they reach out to?
Right. So I would say that the best thing potentially is to go to our online website. And it's geared towards the adult program, but the information regarding the surgeries and what that looks like and how that feels is the same for the adolescent. And then the next step is actually to come in for a surgeon consult, and us, as well as the family and the patient, try to decide if surgery is the right option, if now is the right time for that patient. And then we get them plugged into our medical weight loss program at the Children's Hospital of Wisconsin and the New Kids program to help them through a medical weight loss program.
And then what's the average timeline from when they come to see you to when they can anticipate having surgery?
Most of the insurance companies that cover adolescent bariatric surgery do require 6 months of medical weight loss. So it's at least 6 months, and I would say the average is about 9 months.
Okay, and then what are the types of surgeries? You mentioned the sleeve gastrectomy. Is that the only one you typically perform, and what can people kind of expect afterwards?
Yeah, I think my go-to for most adolescents is going to be a sleeve gastrectomy. Compared to a gastric bypass, the complication rate is slightly lower. There's slightly less nutritional deficiencies. And so it's a procedure I feel a little more comfortable with for the average adolescent bariatric patient. But for some patients, perhaps a severe type 2 diabetic, somebody who has really severe gastroesophageal reflux disease, and who I feel like has a good knowledge base about a gastric bypass, understands the risks, the benefits, that can also be a really powerful operation for the right patient. So those are the two primary operations that we offer.
It's really tailored to the patient, really a discussion about what would be the best choice for them.
And in our program, we strongly believe that there's not one right answer for each patient, and each patient is different. They have different needs, different homes that they're going back to, different monetary amounts that they're able to accommodate for these surgeries. So it needs to be based on that individual and choosing a surgery that's right for that patient for the long term, not just a go-to surgery.
Makes sense. What would you say to the parents who have obese children, or to any adolescents watching who might be struggling with their weight? What would you tell them from here on out?
Well, first is they're not alone. So just like in the adult patient population, morbid obesity is affecting our Wisconsin adolescent patient population at somewhere between 8 to 10%. So while they may feel isolated in this journey, they're not. And you know, if they're not ready to make that surgeon visit or to even look into bariatric surgery, probably the first right person to talk to is their pediatrician. It can be a difficult conversation to bring up, but most pediatricians are very interested in trying to help them initiate a diet plan, an exercise program, and if that's not working, help them get into a medical surgical program to take that next step.
That's great. Well, sounds like you're really affecting lives, Dr. Kindel.
Thanks.
Thank you for joining us. And we'll see you next week for our next video series. Thank you for joining us.